With people now returning back to work, restaurants opening up, some community parks, some pools, I am sure that you are being asked the question either by your own family or by your friends or by your patients and their families, what is safe? Where should we go? Where should we avoid? And being asked that can sometimes create a lot of anxiety around what should we be telling people? What should we be following? And so I thought it might be helpful today for us to take a closer look at how to answer and respond to those questions for ourselves and for the patients and families that we serve. So the first place that I think we have to begin with is, no matter how much we want to tell ourselves a story about what is safe, what is not safe, we have to begin at the core, which is, what are the CDC guidelines? Those are not negotiable. Those are set in place for us to follow. And then everything around that becomes more of the areas for us to make specific and personal decisions. So I think if we begin our conversation with ourselves and our families and our patients around the CDC recommends as their guidelines the following: good hand washing, wearing of a mask, and 6 feet social distancing. If we start there, that is the guiding principle, and then everything else around that, we need to do a risk-benefit evaluation. So looking at where are the things that we want to do or want to engage in, what is the risk level, what are we willing to tolerate around that risk, and then what is the benefit or the payoff for us. Dr. William Miller, who's an epidemiologist from The Ohio State University, has a phrase that he uses, and it's time, space, people, place. And so when we start to do a risk-benefit analysis around all of our choices about where to go, where to avoid, and how much risk should our patients be taking based on their comorbid vulnerabilities. And so thinking about each choice socially and personally that people want to make, looking at time, space, people, and place. So let's break that down. So one thing about time, we know that the longer we are in a particular space, our risk factors go up, which of course is why we know that healthcare workers are more at risk, because you're working an extended period of time in a specific space. So we can apply that same principle when we're out in the community. If you're going in for a 40-minute haircut versus a 4-hour color cut, perm, or whatever all you're doing in the salon, your risks are different the longer you are in that chair. And so thinking about time when it comes to a number of the activities that we want to engage in is an important element to making a decision about safety. And then the other thing is about the space. We know, and we've heard a lot about, being outdoors in open space allows us to have more access to opportunities to remain 6 feet apart. And being out in fresh air, where the air is certainly circulating in a different way than it would be indoors, certainly lends itself to reducing our risk. The people that we're going to have contact with, who have they had contact with? What is their belief system? If you're inviting friends over who you know have decided that this virus is silly and it's nonsense and we're all overreacting, and they're out living their best life and doing whatever they want, you may decide that that person is not the right person for you to have contact with because of the potential higher risk that they carry. And then the place. Back to looking at, is the place somewhere where you can socially distance safely? Does it have a source for fresher air, or is it an indoor enclosed space that puts the risk a little bit higher? So with summer now upon us, let's take a close look at how we can apply those principles to activities that we may want to be engaging in, or activities that patients are asking you, should I be able to do this? So one of the things that a group of infectious disease specialists and epidemiologists has shared with us as a low-risk activity is things like a backyard barbecue with a handful of people. Because the backyard allows us to maintain social distance. We're an outdoor space. If you know and have vetted the people who you are inviting over, you know where they've been, or essentially how they value and how restrictive they have been within their own life in terms of maintaining safety around this virus. And then the other component is, if you're doing the backyard barbecue, that you keep the risk even lower by asking people to bring their own food and their own drink. The infectious disease specialists remind us that it's not that the problem is with the food, it's with the contact of shared utensils, shared food products on a platter. That could be the potential sharing or transmitting of the virus, which makes the risk higher. Another area that is relatively low risk is pools that you know you can maintain social distance. So being in the water, keeping your chairs far apart from one another presents a relatively low risk. The risk goes up if you look at the point of entry and exit into that pool area or that park that you're going to. That is the place where the lines are forming and people tend to congregate, which increases the risk from low to more moderate. And the areas that continue to be the highest risk is indoor restaurants, because when you look at those principles that we talked about, we tend to be in those restaurants for a longer period of time. We are eating, so the mask is pulled down. Having conversation or talking potentially can release the virus in the air. And then we know that there are a lot of people, even with a 6-foot distance, if you are indoors, you don't have the opportunity to move yourself further away from others. And the most high-risk area that has been identified in terms of activities for the summer is the nightclubs and the bars, for a number of obvious reasons. We certainly know that when we add alcohol to the mix, we are less likely to be vigilant. We are less likely to be mindful of what our safety parameters are all about. And if it's an indoor activity, an indoor bar, an indoor nightclub, once again, you are in more confined space, which makes it even harder for social distancing. Laughing, eating, drinking, and dancing all have the potential to release the virus into the air with each of those activities. And so again, being very mindful that being in a closed nightclub or bar presents one of the highest risks. And another high-risk area, when we put all of those parameters to the test, is religious gatherings, for a couple of reasons. If the religious gathering is not outdoors, but rather indoors, they tend to be for a longer period of time than just a 15-minute come in and come out. And in most religious services, there is the singing or the talking. And unless people are coming into the service masked, the risk for the virus becoming more airborne with people in close proximity makes religious gatherings another potentially high-risk situation. So I hope that all of that is helpful when we think about all these decisions about, can we go here? Should we go here? Should we have this person over? Should we allow people to come into our house and use our bathroom? If you apply those principles of time, space, people, and place to each of these decisions that you're trying to make about safe social gatherings or safe social activities over the course of the summer, I hope that it makes your decision making less stressful, gives you some guiding principles to have conversation with your patients and your families as to how their risk factors fit into these parameters. Stay well until I see you in the next one.